Hello, hello, hello. Welcome to Be Bold America. I'm your host, Jill Cody, along with my co-host, Dr. Pettis Perry. Hey, Pettis, we had quite a conversation yesterday about the history of our healthcare system, didn't we? It was one of the most meaningful conversations I've had in a long time.
Hi, my friend. It was for me as well, and I hope that we can bring some of the energy that we exhibited yesterday to our audience today, along with the energy that our guests will bring to our show.
Oh, I know we will, because our program today is The Hidden History of American Healthcare, Why Sickness Bankrupts You and Makes Others Insanely Rich. Our bold guest today wrote in his most recent book, quote, "The simple fact is that, were it not for slavery, white supremacy, and the legacy of scientific racism, America would have had a national single-payer healthcare system in 1915. This statement is not only astounding, but deeply saddening. So much suffering, so many lives lost between then and now. And back then, there was one man who played a key role of injecting our healthcare system with what he called scientific racism. That continues its ugliness to this day. We'll learn more about this person later in the program. What is the solution? A system that will provide extraordinary benefits for us and our economy. Medicare for all. Or maybe it should be called Medicare for all of us. We have big things to do. Our guest today is a 4-time winner of the Project Censored Award, a New York Times best-selling author of 32 books, and America's #1 progressive talk show host. His show is syndicated on local, for-profit, and nonprofit stations like KSQD 90.7 FM and broadcast nationwide and worldwide. He is also simulcast on television into nearly 60 million U.S. and Canadian homes. Hello, Thom Hartmann. We're delighted to be able to discuss with you today your newest book, The Hidden History of American Healthcare. Welcome back to Be Bold America.
Hey, Jill. Hey, Doc. It's great to be here with you both.
Oh, we're just delighted to have you. And Thom, we have so much to talk about. Pettis and I made pages of lists of questions. But first, I want to reintroduce you to our co-host, Dr. Pettis Perry. Pettis and I spoke for quite a while yesterday about your book, and I was surprised to learn that he had some powerful reactions to it that I think you'll be interested in hearing. So, Pettis, why don't you start now and share them?
Sure. Thanks, Jill. Hi, Thom. How you been doing, man?
I'm well. How are you?
I'm doing well. I'm very much looking forward to speaking with you today. Thom, I want you to know that your book is the most personally impactful and profound book that I've read in many years. I urge everyone in our audience to make this a must-read for understanding why we do not have a healthcare system for all in this country. On a personal note, as someone who is largely identified as being black, I need to share with you that I really struggled with getting through your book because it had such profound meaning to my life. My consternation can be summed up in a single sentence from page 54 of your book, and I quote, "Racism is the main reason that America doesn't consider health care a human right and provide it to all citizens, as does every other developed country in the world," close quotes. It seems to me that every single time that something goes wrong in this country, it's laid at the feet of black people and other people of color as being the causation. So for me, as I read that passage in particular, I felt another very heavy weight placed on my shoulders as someone who has had to contend with racism for the entirety of my life. But I also want to say to you that you laid another brick in my foundational understanding of institutionalized racism using healthcare as the example. We'll go into this more fully as we get deeper into the show, but I wanted you to know from the outset the tremendous impact your words have had on me personally.
Well, thank you. I'm glad my work was of value. Frankly, the stuff about Frederick Hoffman which we'll get into, was for me when I started researching this book almost 2 years ago. And, I thought it was just going to be kind of a normal deep dive into, wonky healthcare policy. And what I discovered was something completely altogether different that I fully did not expect, and I'm frankly astonished. I've been in these, swimming in these political waters my whole entire life, and I've been doing a radio show about politics since 2003. I'm well read on these topics, and I had no idea how deeply, white supremacy and racism in the United States had twisted and corrupted and corroded our healthcare system, or prevented us from having one, frankly. And it blew my mind. I think this book and the first book in the series, The Hidden History of Guns and the Second Amendment, which lays out how and why the Second Amendment was written at the time it was, almost exclusively to maintain the slave patrols in Virginia and Georgia, are two of the, I think, most consequential books in this series, and by coincidence or not, I suppose, both deal with this issue of race and how it's distorted American history so badly. I guess the not coincidence would be that this has been the overlay. It's referred to as America's original sin, but it has overlaid every aspect of American life from the beginning to this day.
Yes, it has. Jill and I want to kind of walk through the chronology of the key events that you spoke about and illustrated in your book so that our listeners will have a solid understanding of how we got here today. So let me ask our first question. Republicans consider themselves to be originalists when it comes to the Constitution, whenever it's convenient for them to do so. Would you speak about George Washington and John Adams and their thoughts and actions regarding health care?
Well, George Washington mandated the first vaccine. I think that's fairly widely known now, when he ordered his troops to be vaccinated for smallpox at Valley Forge in 1776 during the War of Independence, and which arguably saved America. He lost more soldiers to smallpox than he did to battle, and that vaccination process put an end to that. He also signed the first legislation that provided health care, food, and housing and clothing for the poor in Washington, D.C., which was the responsibility of the federal government. For those people who say, "Oh no, that's socialism," George Washington would never do that. And John Adams signed into law the first essentially single-payer health care system. It was restricted to a relatively small number of people. This was during the Washington administration. Alexander Hamilton, who was Secretary of the Treasury, had come up with his 11-point plan for American manufacturers to turn America into a great industrial power, and it actually stood right up until the 1980s. And did turn us into a great industrial power. And a key to it was having the ability to sell our goods overseas, and thus we had to have a very healthy merchant marine, a civilian force. The civilians who manned well, they weren't ocean liners back then, but the boats that carried our commerce around the world. And so to keep those people healthy, John Adams signed legislation mandating that they all be part of this single-payer healthcare system that was largely funded by the federal government to keep them healthy. If I'm remembering the points, it's been a while since I've read my own book, but if I'm remembering the major points, I hope I touched on the ones that you were referencing or thinking of.
You did, and thank you for that. Jill, do you want to take it?
Yes, I just have to chuckle because, George Washington and John Adams, those communists, those socialists.
How dare they?
How dare they start our country like that? Until I read this most recent book in your Hidden History of America series, I had no idea, Thom, the astounding role that Otto von Bismarck, Chancellor of Germany, played in creating universal health care. I love Bismarck's quote that you wrote about. He said, quote, This man expresses the French view that every French citizen has the right to starve and that the state has no responsibility to hinder him in the exercise of this right. Tell us about Bismarck and who he was referencing.
Well, he was referencing one of his political opponents who was, if I'm remembering the quote right, who was condemning him for being a socialist for putting into place in 1884 the world's first single-payer healthcare system. Keep in mind, Otto von Bismarck was no liberal.
No.
He was somebody who enjoyed having people tortured in his presence. He was the leader of not the German Republic, but the German Empire. Right, he led people in battle. I mean, he was a total badass. Whatever, Hitler, viewed him as a role model in some ways. So Bismarck puts into place a single-payer healthcare system in Well, first of all, he starts out. It's the German Empire, right, all around the world, and so he's like, how do we have the healthiest populace and the healthiest army? And he's particularly concerned about the army, but the populace is what feeds the army. It's where the army comes from. So how do we have the healthiest Germans in the world, or be the healthiest country in the world? And he put his best thinkers on it, and what they came up with was the best way to produce a healthy populace is to have a single-payer healthcare system where the government pays for everything. It's funded by taxes. And, you don't have layers of bureaucracy. You don't have private corporations. You don't have insurance companies as middlemen who are sucking, their 10, 20, 30% off the top. And he put that into place. He got a lot of flack for it. They called him socialists. Keep in mind, this was the 1880s. Karl Marx's ideas were really starting to have an impact. Marx published Das Kapital in, I think, 1846 or 1837, but, just before the Civil War. But by this time, Marx was really starting to be taken seriously. The early rumblings of what became the Bolshevik Revolution in 1914 in Russia. And Bismarck just slapped him down when they called him a socialist. He was having none of it.
Good for him. Yeah. I wish we'd be a little more bold about that, too, when the Democrats are called socialists. And, well, that's why I thought it was astounding, because I had never read anything about Bismarck caring that much, since he was such, as you said, badass. So there's another socialist, and it just seems, I'm just so tired of this message constantly through history when you try to help people that you're called communist or socialist, and it's just been for decades and decades. Back to you, Pettis.
Thanks, Jill. Thom, we were kind of dancing around a very important historical figure in the line of succession for healthcare. You talked at length in your book about Friedrich Ludwig Hartmann, who was a German immigrant. He was a statistician and an authority on scientific racism, which has been debunked as a pseudoscience, but it's still parroted in many ways today. And he also talked about his beliefs about blacks dying out, class issues, and the notion of health care for all. Would you share some of your thoughts with our audience about his role now more than 100 years later in undermining our current system or attempts for creating a system for health care for all today? Sure.
I'm happy to. As I said, this is one of the things that boggled my mind when I was doing the research for the book. Back in the 1880s, the decade that Bismarck put single-payer healthcare into place in Germany, a young man, 17 years old, with $5 in his pocket, came from Germany to the United States, Frederick Ludwig Hartmann. And he was a numbers genius. He was a math freak. He was a savant, kind of. And he was the guy who, he got a job with the Prudential Insurance Company, which was the largest health insurance company in the world at the time. And he ran numbers for them. And he was the guy who discovered that there was an association between lung cancer and cigarette smoking, and exposure, and working in cotton mills, and lung fibrosis, and asbestos exposure and mesothelioma, which is what killed my dad. The asbestos companies, in fact, covered that up. My dad was exposed in the 1950s. He discovered this in the 1890s. But he co-founded the American Lung Association, which I think is the Easter Seals, or I don't remember which one it was, or the Marshallines, or whatever. But it's one of those iconic things from my childhood. He co-founded that back in the day, and he was really quite famous for this. He also discovered that there was an association between eating diets high in processed foods and cancer. And his book on diet and cancer is still in print in 2021, and he died in 1946. So he was taken very seriously, this guy. So he decided in the 1890s to apply his numbers skill to the, quote, race problem in America. And also, he was doing this on behalf of Prudential because they were starting to think about offering life insurance policies to black people. Until that point, they hadn't. And in fact, because of his, quote, research, the Prudential Life Insurance Company was charging black people more than white people for life insurance right up to 1965. I mean, this is like recent stuff. And there's also this, affects how Medicare came about. So anyhow, he did the numbers, and what he found, sure enough, no surprise, black people were dying at a higher rate than white people. Their lifespans were not as long, and they were more likely to get sick and get consequentially sick when they did get sick. And keep in mind, this was in the 1890s. This was, we had legal apartheid in the United States. We were only 40 years out from the end of slavery. Black poverty was massive. These, with an understanding of institutional racism that we have today, which, you would think that he would have understood, but he clearly didn't. He had married this Southern belle from Georgia, and her family was all plantation and all this kind of stuff. So the conclusion that he came to was that, number one, Prudential should charge more for life insurance. Number two, that blacks, African Americans, were genetically inferior to whites, and that was the reason why black people were dying at a higher rate and getting sicker. And number three, that because of that genetic inferiority, that he didn't just conclude this in a vacuum. I mean, this is kind of pretty much a widespread belief by white people in the United States, and there are still white supremacists who will claim this today. But therefore, if we simply denied black people health care, in a couple of generations, the black race would die out, and it would solve the race problem in America. And he just came right out and said it. And this became he was celebrated for this. He wrote this book in 1896 titled "Race, Traits, and Tendencies of the American Negro." I found a copy of it in an old used bookstore, and read it, and it blew my mind. But it was a major international bestseller. He testified before Congress. He traveled around the country. He met with governors and state legislators. He pitching this thing. And this is why in 1914, when Teddy Roosevelt was running for re-election on his Square Deal program, which included a single-payer healthcare system modeled on Bismarck's, the blowback that he got from white people was, but wait a minute, we don't want black people to have health care. That doesn't go with the plan. And so Teddy had to back off. And then in 1936, when Franklin Roosevelt pitched, a national health care program, again, the blowback was, but what about the black people? We don't want them to have this. Same thing in 1947 when Harry Truman got a proposal before Congress for a single-payer health care system. He got shot down again by the white racists in the South, largely, although, there were white racists all over the country who didn't want black people to have access to this. And in 1961, when John Kennedy proposed it, again, it was white Southerners who shot it down. And in 65, when Lyndon Johnson said, okay, let's just give single-payer health care to everybody over 65, we'll call it Medicare, again, the Southern senators came and said, wait a minute, if you're going to have elderly black people coming into our hospitals, you got to set a bar that's high enough that they can't jump over it to get in. So what they worked out was this 20% gap in Medicare is there to provide a barrier to poor black peoples, because they would know that they would have to cough up the 20% when they got to the hospital to keep them out of the hospitals. And it's just a grim story any way you tell it, but that's what it is.
Oh, wow.
Yeah.
Do you have a follow-up?
That was another thing.
Do you have a follow-up, Pettis?
Well, no, I was just saying that, that was one of the other points that was really devastating as I looked at this institutionalized process for limiting who gets health care that's still impacting us today.
Oh, let me take it a step farther. There are 12 states in the United States that turned down Barack Obama's offer of expanding Medicaid, which goes to people who make more than $3,000 a year and less than $11,000 a year. It varies from state to state, but broadly it's in that range. There are 12 states that said, no, we don't want the money, even though the federal government paid 90% of it, and will today, even today. And those 12 states are all former slave states. Yeah, with significant black population and white control of the states. It's still going on.
Well, you touched, Thom, on FDR, and in your book you talked about FDR and Edwin Witt set off a proverbial bomb with the Republicans when they referenced the need to study the possibility, among other things, health insurance. And then just a bomb went off in the Capitol with the Republicans. Just, can you take a few minute or a minute to tell us what the Republicans' response was to that?
I'm sorry, I missed the first couple of words.
It was FDR and Edwin Witt, I think, set off just a bomb when FDR was talking about the need to study the possibility, among other things, health insurance. The Republicans just went nuts about that.
Yeah, well, that was as I recall. I don't recall that specific incident. I'm sorry, I didn't look. It's like I said, it's been a while since I read my own book, and some of the stories in there are not things that I knew before. But I'm guessing I'm working on a book on neoliberalism right now, and I'm reading F.A. Hayek. And he's laying out this hypothesis that the Nazis came to power because Germany had a single-payer healthcare system starting in 1884, that socialism was the foundation for Nazism. The Republicans say that to this day. Rand Paul has recently said that. And so I'm guessing, if I'm remembering correctly, that the Republicans were all over, offering everybody health insurance is just another form of socialism, and it'll lead to terrible things like Hitler has done. Am I remembering correctly?
Right. Well, it's just they again accused FDR of secretly trying to foist compulsory health insurance on the country, and they created a deluge of telegrams from all parts of the country protesting against that nefarious plot to give health insurance.
And it wasn't just Republicans. I mean, a lot of that came out of organized medicine as well. I mean, the AMA was all white, the hospitals were all white, and there was this concern again that if everybody in America got anything, that meant that black people got a piece of it. And so,
boy. I'm just going to break right now and say you're listening to our bold guest, Thom Hartmann, on KSQD's Be Bold America, Many Voices, One Station. In addition, if you'd like to be added to our news group, you may text Be Bold America to 22828. Text Be Bold America to 22828. I'm your host, Jill Cody.
Have a world-class healthcare system? Yet, while we spend the most of any advanced nation in the world to get care, more than $10,000 a year per person, we get the worst results. No surprise, then, that the Medicare for All idea is now backed by 85% of Democrats, 66% of independents, and get this, 52% of Republicans. So why isn't Congress responding to this overwhelming public demand for universal coverage? I suspect that one big reason for Washington's big yawn over the people's plea for sweeping reform is that our lawmakers do not personally feel the financial pain and emotional distress that are inflicted on millions of regular Americans by a system built on private greed. After all, their health needs are met by a double dose of the socialistic care that they so furiously deny to our families. First, they're given big taxpayer subsidies to cover the cost of their insurance, with you and me paying about 72% of the price. But second, there's a secretive medical center located right in the U.S. Capitol building that provides a full-blown system of healthcare socialism to our governing elites. Called the OAP, Office of the Attending Physician, it provides a complete range of free medical service for lawmakers. No appointment needed and no waiting. They walk in and doctors, nurses, technicians, pharmacists, and other professionals tend to them right away. No need to show an insurance card, and they never get a bill. But they do get what a former OAP staffer calls the best health care on the planet. Thus, members feel no urgency to restructure a system that's working beautifully for them. This is Jim Hightower saying, so to get good care for all of us, we might start by taking away the pampered care that lawmakers have awarded to themselves.
If you're just joining us, we're speaking with Thom Hartmann. Listen to his #1 progressive talk show Monday through Friday right here on KSQD 90.7 FM, also on Sirius XM Radio, Free Speech TV, and on the Thom Hartmann app, which is how I listen to him every day. Our topic is the hidden history of American healthcare, why sickness bankrupts you and makes others insanely rich. So, Thom, how has America's health deteriorated since Ronald Reagan played a role in, and did Ronald Reagan play a role in it, that even today, 1 in 5 of us have poorer health and hefty health care bills?
Yeah, this is Reagan, of course, not only opposed any kind of single-payer healthcare program, but before he was president, when he was governor of California, and in fact, I think this might have even been before he was governor of California. This was 1964. When they were putting together, maybe early '65, when they were putting together the Medicare legislation. He recorded a 33 LP long play album record that for the American Medical Association, for the AMA, talking about how Medicare was socialized medicine, and it was the camel's nose under the tent that would turn America into the Soviet Union. And that he wrapped it up by saying, someday, Americans will look back, or someday, those of us old enough to remember will look back and tell the young folks about, what it was like when America was free. And of course, he was not of the generation to say that about Social Security, but that was the same argument that was made in 1933 against Social Security. And to this day, a lot of Republicans consider both these programs socialism. George W. Bush campaigned in 1978 for Congress in Texas on the platform of privatizing Social Security and Medicare. And so there's that. You've got that opposition. But then also Reagan introduced neoliberalism to America, this whole brand new economic and political system, largely an economic system, but it is enforced politically, of so-called free market capitalism, tolerating monopolies and basically allowing big business and billionaires to run the nation's politics. And the consequence of that is that the middle class has been gutted. We've gone from a third of Americans being represented by unions and having good jobs with health care and pensions and all that kind of thing in 1980 when Reagan came into office to about 6% today of the private workforce. And as a result, wages have stagnated over all these years while medical costs have exploded. And as a consequence of that, the spending that American families do on housing, on clothes, on transportation, on pretty much everything else, vacations, has decreased as healthcare expenses have sucked up more and more of our money. And then, of course, you've got, probably, I don't recall the number, but, somewhere in the neighborhood of 150 million Americans who are deeply underinsured. They've got, half of American families can't deal with the $1,000 expense. And I believe it's 60% of American families can't deal with a $400 expense, and yet most people have health insurance policies with $5,000 deductibles or in that neighborhood. So people aren't using what health insurance they have because it's unaffordable, and very often it doesn't cover things that they have or networks that they have. And all of this is just a perfect storm. It has decreased the lifespan of Americans slightly. It has dramatically increased chronic diseases and things like obesity and diabetes, heart disease. These are the just clear consequences of the inequality and the stagnation and even reversal to a large extent of the bottom 90% in America. The top 1% have done just fine, thank you very much. They've taken at least $10 trillion out of the pockets of working class people since the 1980s, and stuffed it into their own money bins. But that's where we're at.
Oh boy, Pettis, you were going to ask Thom about Medicare Advantage.
Yes, I was just getting ready to do that.
Good.
Thom, could you talk to us about Medicare Advantage as a trillion-dollar boondoggle and how it can be used by insurance companies to kill off Medicare for all? And while you're at it, if you wouldn't mind talking a little bit about the gap in the Medicare system and how that's used. You touched on it a little bit a few minutes ago.
Yeah. Well, with regular Medicare, first of all, Medicare has been around since 1966, and Medicare Advantage came along in 2003, if I'm remembering correctly. And maybe it was 2005, but it was one or the other. And, it was George W. Bush's brainchild as a way of privatizing Medicare. When Medicare was originally put into place, there was this 20% gap, which I mentioned earlier, and the idea that private health insurance companies would fill that gap was also, that was also part of the motivation for it. Was the health insurance company or the insurance companies wanted to have an opportunity to make some money here. But the Medigap insurance. So if you go on regular Medicare, parts A, B, and D, and it costs you $100 and some odd dollars a month. I think it's $140 a month on average, and they take it out of your Social Security, or they can. And then you also have to buy a health insurance policy, a Medigap policy that fills in that 20%. And those can be anywhere from $100 to even a couple $100 a month, depending on the quality of the policy that you get. But they're heavily regulated. They can't mess with you. They can't refuse to cover things. They can't talk about pre-existing conditions. You could be sick as a dog when you turn 65 and sign up for them, and on your absolute last legs, and they still have to fully cover you for without jacking up the price. So in 2003 or 5, whichever it was, you've got the book there. Maybe you can, if you know, just correct me. But in the early 2000s, George W. Bush had this Medicare, what would you call it, optimization improvement. And what they did was they took Medicare Part C, which had been around forever, but was almost never used, which was it was kind of a little carve-out in Medicare so that private insurance policies could be written for some Medicare recipients, and but on a very limited basis in a very narrowly confined areas. Sort of like, there's some people who don't get Social Security because they're certain types of federal employees. If you work on the railroads, for example, you pay into the Railroad Pension Fund and Social Security. So there's these little carve-outs in both Social Security and Medicare, and this was one in Medicare. And what George Bush did is he turned that carve-out into a superhighway and said private health insurance companies can come in, they can offer these private policies. They are not regulated the way that Medigap policies are, so they can screw with you. They can say you can only go in network. You can, it's just they do these two practices called cherry picking and lemon dropping. Cherry picking is they offer, goodies that would attract, in particular, healthy people, like gym memberships and things. And trying to bring in the healthy people when they turn 65. But then as people get into their 70s and 80s and start getting more expensive, then they shift to what's called lemon dropping, which is where they just basically make life miserable for people with Medicare Advantage, to the point that there was just a study that was published last week that found that the majority of people who drop Medicare Advantage and return to regular Medicare are people in the last year of their life. And that's because in the last year of life is typically the most expensive of all the years of your life. and they find themselves doing battle with their insurance companies at such an intense level that it's just not worth the frustration, and so they go back to Medicare. But the problem is that if you sign up for a Medicare Advantage policy when you turn 65, and then you decide when you're 66 or 67 or a little bit older that you don't want to deal with the insurance company telling you that you've got to get pre-approval for everything, and you got to pay co-pays, and you got to do this and that and the other thing, all this BS that goes with Medicare Advantage. If you decide to go back to regular Medicare, now the companies that are offering the Medigap policies, which are typically the same companies that are offering the Advantage policies now, those companies now can refuse to insure you if you have pre-existing conditions. And so a lot of people, some people, when they try to go back to regular Medicare, they just can't buy a Medigap policy any longer. And so they get stuck with that 20% of the hospital bills, and it can devastate people financially. I had a friend who in New York City, I write about him in the book, in fact, because this all happened as I was writing the book, who turned 65, went online to sign up for Medicare, got hopelessly confused, and just said, I'll do this later. A couple months later, he was having trouble urinating. He went to the doctor. They did a blood test and a prostate exam, and his PSA was like in the hundreds. It was so high that the doc said, you not only have prostate cancer, it's probably already burst outside of your prostate, and we've got to deal with this aggressively. And so as he was leaving, this was one of these kind of urgent care centers that was owned by a big hospital chain, which offered their own Medicare Advantage plans. And as he was leaving, the receptionist signed him up for a Medicare Advantage plan with his company. So then he does his research and finds that the best prostate cancer docs in the world are at Sloan Kettering Memorial Cancer Institute in New York City, literally right down the road from where he lived. And so he made an appointment with them, said, I've got Medicare. They were cool, come on in. He shows up, and a month later, and he's got his Medicare Advantage card, and they're like, oh, this isn't Medicare. This is private insurance. It's called Medicare Advantage, but it's private insurance. And we are not in their network, so they will not pay us. So you're going to have to pay the whole bill yourself. And it turns out that none of the Medicare Advantage plans pay for Sloan Kettering because they're the top one, and they're also a little more expensive. And so, forewarned is forearmed. But now, with all this avalanche of advertising, and you'll see it coming again this fall because the sign-up period opens the second week of October, I think, or the first week. So pretty soon you're going to start seeing Joe Namath again, every single day pitching this. So now about 40%. It was 33%, I think, or 34% when I was writing the book, but 2 years ago. But just a month or so ago, I saw a piece in the Wall Street Journal that said that it's now 40% of Americans who think they're on Medicare actually have private Medicare Advantage plans.
Amazing.
It's terrible.
The system is designed to let us die, I guess.
Well, it's designed to take as much money out of our pockets and the system as possible before we die. I mean, let's say it what it is.
Well, Thom, also, while you were just talking there about Medicare Advantage, I just flashed back to about a week ago on your program. You were interviewing a doctor. I think her name was Anna Malinow, about direct contracting entities, another plot to privatize Medicare. Medicare Advantage is a scheme to privatize Medicare, and then now I guess they have a new scheme to privatize Medicare with direct contracting entities where they lure doctors with more money, and then you sign up with that doctor, and then all of a sudden you're enrolled. Do you remember?
I do.
Oh, good.
Yeah, this was new to me. I thought I wrote the book.
Yeah, it was new to me too. And I thought, while you were talking there, I thought, wait a minute, we need to bring this up.
Yeah, this is just rolled out in the last year, as far as I can tell. And what it is basically these Medicare Advantage providers cut deals with doctors. And under this new rule that was put into place by the Trump administration, your doctor can sign you up, can take you off Medicare and sign you up for Medicare Advantage without even telling you. and it can be a real challenge to get out from underneath it. And the doctors are spiffed by the insurance companies for doing it. So they're doing everything they can to put a nail in the coffin of Medicare before anybody talks about taking. And then, once they've got 60-70% of Americans on Medicare Advantage, then they'll suddenly come out and say, "Hey, we just decided we love this Medicare for All program."
Oh, gosh. Well, that's in the role of Republicans trying to privatize everything. Everything.
Yep.
And then another topic to move to, another insanely rich CEO was Dollar Bill McGuire, who was United Healthcare CEO previously, who didn't make any money healing anyone. No doubt the current CEO is following in Dollar Bill's footsteps. And, nearly 4 months ago, I had open heart surgery. And I learned that my retirement program, I was very lucky that, everything was paid for and I came out very well. But my retirement program picked United Healthcare as my coverage. And then I learned, too, that they picked Medicare Advantage. So that's another way that people are enrolled in these things without having any control over it. And while I was going through this adventure, I just thought about, one, how fortunate I was, but that also that the CEO and the stockholders were making money off of people's suffering. And that's what the healthcare system is, basically, is privatizing healthcare to make money off of people's suffering, and it's just so immoral. Thoughts on that?
Yeah. Dollar Bill McGuire made $1.6 billion out of United Healthcare. Now, a lot of that was stock options, and you can't really quite criticize him for that. He helped grow the company. But he helped grow the company by saying, "No, we're not going to pay for your daughter's liver transplant." And he was succeeded by Stephen J. Hemsley, who made something like $700 million. And when you've got a health insurance company where the CEO is taking $1 billion out, you've got a distorted system. I just don't know how to say it other than that. There are literally hundreds of executives across the 6 largest health insurance companies who make over $1 million a year.
It's just immoral, in my mind, to make money off of people's surgeries and suffering and pain. So you're listening to Be Bold America on KSQD 90.7 FM, many voices, one station. You also may listen online, live at ksqd.org. Want a friend to hear this interview? Ask them to sign up for a free subscription through their favorite podcast platform, such as Apple, Google, Spotify, Radio Public, and many others, to hear this outstanding interview with Thom Hartmann. I'm your host, Jill Cody.
Hello, K-Squid listeners. I'm Thom Hartmann, and each weekday at 4 p.m., I bring you a different perspective on the news than you're likely to hear on most media outlets. Please join me on KSQD, Santa Cruz, your ink spot on the dial for the Thom Hartmann program, heard now for the first time ever in the Monterey Bay area at 90.7 FM, weekdays at 4 p.m. That's progressive talking conversation with me, Thom Hartmann, weekdays at 4 p.m. on KSQD 90.7 FM. Tag, you're it.
Today, our topic is the hidden history of American healthcare, why sickness bankrupts you and makes others insanely rich. And we're speaking with Thom Hartmann, who we just heard on our break, who is a 4-time winner of the Project Censored Award, a New York Times best author of 32 books, and his #1 progressive talk show host. And, again, I'm looking at all the questions that we have, but I did want to bring out, because I think people don't really realize, I have followed Rick Scott's career, and he's plainly a crook.
The former governor of Florida. Senator from Florida.
Right, he took the fifth. Go ahead.
His company, when he was CEO of his health hospital chain, his company was convicted of the largest Medicare fraud in the history of America.
Yes. Bill Gates took the fifth 78 times when they were questioning him. And then he became governor of Florida, and now he's a senator. in Congress? How on earth does something like this happen, and why isn't he in prison? And just briefly tell us, before we go into our keep, stop, start, briefly tell us about Charlene Dill's story. Powerful story.
Charlene Dill was a young woman. She was in her early 30s in Florida with 3 kids. And what's particularly haunting for me is I have a photo of her and her kids. And her son looks so much like my son looked when he was the same age that it shocked me. I thought I was looking at a picture of my own son. Ooh. And she was, a single mom, and she had a heart condition that she'd apparently been born with, and that was easily controlled by medication. And but because Rick Scott did not expand Medicaid in Florida, and to this day it hasn't been expanded. It's one of those 12 former slave states I was talking about. Because he didn't expand Medicaid in that state, she was cutting her pills in half and skipping pills because she couldn't afford them. And she was working 3 jobs. And her third job was selling vacuum cleaners door to door, and she was doing that one evening when she just, dropped dead of a heart attack because she'd been skipping her medications. And so I titled that chapter, Rick Scott Killed Charlene Dill, because he was the governor, and he was the one who chose not to take the Obamacare money and expand Medicaid to the working poor in Florida. And, of course, Ron DeSantis is following on in that tradition. And you ask, how could a guy who, ran a company that was convicted of the largest Medicare fraud in history, who took the fifth 76 times, who walked away with, $100 million or thereabouts, a big pile of cash, use that, and then use that money to run for political office, how could he become the United States Senator? Well, that's the perfect resume for a Republican. Is he corrupt? Yeah.
Yeah.
Thumbs up.
Oh my goodness.
It's sad, but it's unfortunately I can't say it's not true. I mean, I've been running a contest on my radio show since 2003. Anybody who can name one piece of legislation that was originally written by Republicans, that was passed by a majority of Republicans in the House and Senate, and that was signed into law by a Republican president, one piece of legislation in the last 40 years whose principal beneficiary is average working people or poor people, I would give them their choice of any of my books autographed by me. Or, I've offered other prizes, too, over the years. Nobody's ever won that prize, and nobody ever will.
Nobody ever will. They've given up on legislating. They've given up on writing bills. They've given up on governing. Go ahead.
Except when they're in power, and then they're all about tax cuts.
Well, that's right. Isn't that a form of socialism? Socialism for the rich?
I think you could make that argument.
Pettis, do you have, before we go into Keep, Stop, Start, and do you have any quick follow-up on our talk with Thom?
I do. The whole system is designed to support itself, right? With the people that get into office who are paid by the insurance companies and the healthcare industry to make sure that legislation doesn't come that's harmful. But you also speak in your book about how we can create a system for healthcare or Medicare for all. Can you take a quick minute to describe that?
Are you talking about doing what Canada did? Because there's a couple of different solutions I offer in the book.
Several examples of how we could do this.
Yeah. I think the most likely way that we will get this done here in this country is at the state level, which is what Canada did. Tommy Douglas, the premier of Saskatchewan back in the day in the 60s, who's every year rated as the number one favorite person in all of Canada. He's been dead for quite some time. He's Kiefer Sutherland's grandfather, actually. He passed this in that particular province, and the provinces around it were so amazed by how well it worked that they were like, hey, we want that. And so pretty soon Alberta got it, and British Columbia got it, and and it just spread across Canada over the course of about a decade, and then the federal government jumped in and said, okay, we'll backstop you guys, and we'll provide a exchange mechanism for, if somebody from Saskatchewan gets sick in Ontario, then Ontario can pay for it, and then we'll work out the back end, reimbursement from Saskatchewan. And and Bernie actually talked about this on my program like 10 years ago. He said that he thought this is how it would come to America. And so Vermont and California have both passed legislation authorizing single-payer healthcare systems in their states, both of them. And the one in Vermont was signed into law by the governor. But the problem that they have is that because LBJ was worried back in '65 that if they just gave Medicare money to southern states, the southern states might use that money to treat white people and refuse to treat black people. And so there's a kind of an audit trail on Medicare money and on Medicaid money also that if you can't maintain it exactly the way the law lays it out, the money just goes to zero. It vanishes. And so when Vermont tried to do their single payer, they ran up against this and discovered that if they did single payer in Vermont, then they would have lost billions every year in Medicare and Medicaid money. All that money coming into the state would just cease. And they would have to pick up those expenses themselves, which would have broken the state. So the movement is to tell senators and members of Congress to pass, and these are introduced every year, to pass a waiver, a state-based waiver, so that individual Medicare, Medicaid waiver, so that states can do single-payer health insurance. And eventually we'll get that thing passed. And I think, if California and Vermont do it, and it works, and of course it will, every other country in the world has done it pretty much for the developed country, then it will spread.
So, Thom, that was just a perfect segue to go into Keep, Stop, Start, which is what can listeners do to advance this effort? What can listeners keep doing, stop doing, and start doing? Obviously, they can start contacting their federal representatives to pass that state waiver. What else can listeners do?
Well, I think, talking about it, sharing these stories that you and I have been talking about today with friends and family, warning people about Medicare Advantage and the other efforts to privatize Medicare. I think it's just, we need an informed and educated populace, and these are issues that are literally never discussed in the mainstream media. I mean, just never discussed. I've never seen a single program on any television network, even MSNBC, about, for example, the Medicare Advantage scam or the drug pricing scams, because the pharmaceutical companies and the insurance companies are major sources of advertising revenue for these networks. So, that responsibility for educating people falls to all the rest of us.
And what can listeners stop doing? Is there something that you think that they're thinking about or doing now that's getting in the way of Medicare for All?
Other than having, if you've signed up for Medicare Advantage, check out your alternatives very quickly.
Good point.
Yeah, but other than that, I can't think of anything right off the top of my head.
Well, also, we talked earlier, too, I guess this is more of a start as well, is be aware of these DCEs. What were they called again? The direct contracting entities, that they could really privatize Medicare. We might not even know what's happening. Yes,
absolutely. And if you get a letter from your doctor telling, if you're over 65 and on Medicare, regular Medicare, and you get a letter from your doctor saying that he's going to change how he gets reimbursed or she gets reimbursed by the health insurance company, that's not just a red flag. That's a 4th of July fireworks display. Pay very careful attention to that.
Mm-hmm. And also, I didn't realize I have a little Medicare card in my wallet, and I didn't really myself realize till I had this surgery that I'm in Medicare Advantage, even though I have that Medicare card. So I think what you said is that people need to take a look that are in that age group and really clearly understand what they're in.
Yeah, I've been on Medicare. I'm 70. I've been on Medicare for 5 years now, and I've had back surgery. I mean, it's just wonderful. Regular Medicare with the Medigap policy. You know, you never pay a penny. Nothing has to be pre-approved. There's no song and dance. There's no BS from the doctors. You know, whatever you need, you just get. It gets taken care of, and that's what we need. That's what every other developed country in the world has. And I don't know if you went through having to have, you know, your insurance company approve things, or if you ended up stuck with copays and deductibles or not. If you didn't, you have a pretty good policy. And there are some good Medicare Advantage policies out there, at least not terrible ones. They tend to be the ones that are run by the nonprofits, you know, the HMOs. But the ones that are run by the big insurance companies can be a minefield.
Well, and also I think there's a basic question people have to decide for themselves. Is healthcare a right or a privilege? Because that's the struggle right now, and I don't see how we can pursue happiness without being healthy. So,
yeah.
You know, which side of the philosophy are you on? Is healthcare a right or a privilege?
Yeah, and I think, you know, I mean, the Constitution talks about in the preamble, you know, for the general welfare of the people, and the Declaration of Independence, of course, reference life, liberty, and the pursuit of happiness. And frankly, none of those things are available to you if you're sick. You know, Franklin Roosevelt made this point: if you're sick, you're not free. You know, if you're unemployed, you're not free. If you are homeless, you are not free. But in this context, if you're sick, you're not free. And you know, we need to help people get access to health care, and you know, without breaking the bank.
I'm so glad you brought up the freedom point, you know, and what FDR said, because it really is part of that. Thom, we so enjoyed this conversation. I wish we had more time with you. Thank you for being our bold and impressive guest and being with our program again. We know you've got a jammed calendar, and we're just delighted you made time for us tonight.
Well, thank you, Jill, and thank you, Pettis. It was nice talking with both of you.
Thank you.
Our pleasure. Thank you.
Up next on Sunday, October 10th at 5 p.m. will be the Decarbonization Imperative with Dr. Michael Lennox. Dr. Lennox is the Taylor Murphy Professor of Business Administration at the University of Virginia's Darden School of Business. He's also Senior Associate Dean and Chief Strategy Officer. He's the co-author of Can Business Save the Earth? Innovating Our Way to Sustainability. He'll be here to discuss his new book, The Decarbonization Imperative, Transforming the Global Economy by 2050. In addition, Pettis will have a well-deserved break because I'll have a special co-host with me for this interview, Dr. Richard Nothinius. Dr. Nothinius was a chapter author in my book, Climate Abandon, and is an expert on the Garrett relation. He has strong opinions on unacknowledged energy and economic constraints, so sparks could fly. So join us on Sunday, October 10th at 5 p.m. to learn about the decarbonization imperative. Or you may catch up on this interview later with our Be Bold America podcast found on your favorite podcast platform. I also want to give a special thank you to Be Bold America's program engineer, Emily Donham, and to our program director, Howard Feldstein. You're listening to KSQD Santa Cruz, Many Voices, One Station. Listen worldwide online at ksqd.org. Stay tuned for Faith Matters with Seth Shapiro. My name is Jill Cody, and I'm here with Dr. Pettis Perry. Thank you for listening to Be Bold America. Until next time, keep, stop, start.